know, is used in adults. But a lot of people today asking, what about the kids?
Yeah, as children go back to school, parents want to know what their options are if they get COVID-19. So our Verified team tracked down the answer.
With kids back in school, we're getting a lot of questions on our Instagram about the risk of COVID-19 to children. So let's verify. Are there any treatments for kids with COVID-19? Our sources are the University of Maryland pediatrics professor Dr. Jim Campbell, the FDA, the American Academy of Pediatrics, and the National Institutes of Health. The AAP estimates more than 5 million children have tested positive since the pandemic began, and the NIH says most recovered without any special treatment. Still, some kids may suffer more serious symptoms, so doctors modify proven adult treatments.
The same medications that are used in adults when they get sicker are being used for some children. But given that they just don't get as sick as frequently, there's not as much data to be able to support their use, but they're still there and available for us to use.
The FDA authorized remdesivir for children younger than 12 and weighing less than 88 pounds. Doctors can also use antibody treatments for teens who are at least 88 pounds. But in most cases, more traditional treatments will work.
Often they don't need any COVID-specific treatment, only supportive treatment, and that is like keeping their fever down, keeping them well hydrated with fluids, giving them oxygen if they need oxygen.
So it's true, there are treatments for kids with COVID-19. As for the vaccine, Pfizer and Moderna are still studying the efficacy and safety in children younger than 12. With your Verify, I'm Brandon Lewis.